Good evening, everyone. Allison Scoberg here. I'm coming to you from ADA, the Attention Deficit Disorder Association, the Southern region. This organization was founded by Pam Esser back in 1987. It was Pam's hope that we could have an organization that would put out information to help families with ADD, ADHD, and this group, Lindsay, Asawa, and myself formed. We were just discussing, we think it was about 10 years ago that we started this group in Fort Bend County, and it has grown. We have people attending from all over the state and actually people attending from out of state as well. So we meet the last Tuesday of most months. We take a break in the summer, and I think we don't meet in December either. But each month we have a different speaker talking to us about various topics to help us on our journey as we are parenting our kids and sometimes adult kids with ADHD. So tonight, we are excited to have Dr. Lindsay Asawa. She is a licensed clinical psychologist that practices in Fort Bend County, and she'll share a little bit more about her practice. But I can personally say I love Lindsay. I love her practice. They do wonderful testing. So if you have a child that needs to be tested, you have been told that there's a 6-month or a 9-month waiting list at the various children's hospitals or other things like that. There are other outside options that you can explore. So she can chat a little bit more about that. As far as ADA is concerned, you never have to join this organization. You absolutely can. It's super cheap. I think it's like $40 a year. They have an annual conference, and there are ADA chapters all across the state of Texas. There are chapters that serve parents. There are chapters that serve adults with ADHD. So do check that out. Our meetings used to meet in person prior to COVID, and then COVID we moved online. And what we found out is online is a better venue for everybody to be able to tune in and what have you. So tonight we are in webinar mode. So we can't see you or hear you, but we do know you're here, and we appreciate your questions. We ask that you put your questions in the chat box. Tonight's format, we're going to take the questions at the end. You can put your questions in the chat box at any time, but we're going to get through the slides. If you're planning your evening, we will be done within an hour, so you can plan on that. So having said that, thank you, Lindsay, for being here with us again, and I'm going to turn it over to you.
All right, thank you, Allison. Okay, so really quick, a little bit about me. So I am, as Allison said, I'm a licensed psychologist. Part of the reason I'm involved with ADDA is because I've spent so many years working with clients who have ADHD, evaluating clients, children and adults with ADHD. I have 3 children who 2 out of 3 so far have been diagnosed with ADHD. So even as a mom, this is something I'm very familiar with. So I've done many of these webinars in the past. Tonight, I did want to talk about something a little bit different that's not directly related to ADHD, which is social anxiety. And I'll get into that, but I did want to let you know. So I previously was co-owner of Missouri City Family Counseling in Missouri City, a practice in Missouri City for the past 6 years. And now I've branched off and have my own testing practice called Beautiful Brain Psychological Services, which is at the same location where I was previously in Missouri City. And I have my information up here. Feel free to check out the website, email me, call if you have any questions or you need resources. I do want to let you know that I've been working hard to include lots of resources and referrals on my resources tab on my website. And that includes some of the therapists that I refer to, the psychiatrists that I refer to, some of my past webinars that through ADDA or other organizations that have been recorded, and I have those posted on the website for you to watch. So feel free to use me as a resource and reach out if needed. So tonight I'm talking about social anxiety. And the reason I think I actually suggested this topic, and it's because it's something that I've been seeing a lot of, all mental health professionals have been seeing a lot of, especially since COVID. There was a rise in social anxiety disorder due to or related to the COVID-19 pandemic because of kind of the social isolation. And we'll talk about how that can contribute to social anxiety. But I think this is an important topic. It is something I often also see in my clients with ADHD as well. So I may be evaluating a child for ADHD or for a learning disability or for autism. And as I go through that evaluation, I'm seeing lots of signs of social anxiety that are contributing to some of their difficulties. So it's important as parents for us to understand this disorder and what it looks like and what we can do about it. So the first few slides, I just want to define what it is. This is based on our diagnostic manual as mental health professionals. So these are the criteria that we're looking for when we diagnose social anxiety disorder. Now, you can experience social anxiety, but not necessarily meet the criteria as having this disorder. And there's a few reasons for that I'll go through. But this first criteria is kind of the big one, which is marked fear and anxiety about social situations. It could be one or more social situations. And so this is obviously specific to social situations. And this is when someone feels like they're exposed to scrutiny by others, so kind of judgment by others. So a couple things about that. It needs to be something that we're seeing with peers and not just with adults. So with kids, sometimes they feel pretty intimidated when they're around adults. They might have some anxiety and some shyness, but they might do fine with their peers. And that's not what we're looking at here. This is something different. This is something we do see with peers specifically. So the social interactions that are impacted, it could be any type of social interaction. Meeting new people is a big one. Just starting a conversation or carrying a conversation, asking a question, being able to speak up and ask a question. Even things like phone calls, ordering food at restaurants, these are all things that can be impacted and cause that extreme fear and anxiety. Also being observed while you're doing things. So it could be eating or drinking while you feel like others are watching you, or anything that just draws attention to yourself might create that fear and anxiety. And then, of course, performing in front of others. So things like what I'm doing today, presentations and speeches, dance recitals, piano recitals. And this one is, I think, much more common. Public speaking is one of the most common fears. A lot of people struggle with it. So that's not a defining criteria necessarily for diagnosing social anxiety disorder. We need to be able to see that there's some of these other things going on, some anxiety in other social situations in addition to that. This is another one of the criteria, is a really big fear of negative evaluation or judgment from others. So it's not just anxiety about being in that social situation, but it's these thoughts about you're being judged and you're being evaluated, either because of your actions or because of those symptoms that you're having, the anxiety symptoms. So some of those fears I have listed under here. So fears of embarrassment and humiliation around others, worrying that you might be rejected by your peers or you might offend somebody with something that you say. A fear of showing anxiety through some of those visible symptoms like blushing, trembling, sweating, making mistakes as you're talking, stumbling over your words. And then a fear of being judged as anxious or weak or crazy or stupid, all of these labels that we might use. These are some of the fears that are going through someone's mind when they're experiencing social anxiety. And it all relates back to being judged or being evaluated by other people. Here's a really critical thing, is that it almost always, these social situations cause the fear and anxiety, and it's out of proportion to the situation. It's not what we would expect in that situation. And that's really important because we all experience some anxiety in some social situations, and that doesn't mean that we have this diagnosis. In this case, it's almost always happening, and it's more than what we would expect. And some of what it looks like are listed there below. So we may overestimate how things are going to go or how badly they may go. Whatever the negative consequences may be. In kids, this can look like lots of behaviors. They may not express it through their words, but they may cry. They may have tantrums in social situations. They may freeze and not talk to anyone or not interact, not respond. They may hide behind parents, cling to parents. So these are some of the things we see with younger kids. With older kids or with teens, it might be a little more subtle. Things like their posture might be just a little more stiff because of that anxiety. They might have trouble making eye contact. They might talk really quietly. They may blush, they may shake. So these are just some of those kind of subtle signs that we might see in older kids. And a lot of anticipatory anxiety, which is worrying about something before it happens. So thinking this is going to go really badly, or I'm going to hate this party. It's that anxiety before it happens. And it's in a lot of individuals, it can be as extreme as panic attacks, not being able to breathe, feeling their heart racing, feeling lightheaded. Lots of physical symptoms of anxiety can develop because of these fears in these social situations. So it can become severe at times for some people. A couple more criteria are up here in the orange. So social situations, this is a big one, they are avoided. So there's two options that we have when we're feeling anxious in a social situation. We're either going to avoid it and try to get out of it so that we can feel a little bit better and avoid the anxiety, or we're going to endure it and go through it, but we're going to experience intense fear and anxiety as we're going through it. So I may have a client that has pretty severe social anxiety, but they're not avoiding things. And maybe they can't. Maybe they're being forced to do these things by their parents or their teachers, so they can't avoid it, but they're still experiencing very intense fear and anxiety. This is something that has to be persistent for at least 6 months before it meets the criteria to be a diagnosis. So if it's just happened once or twice, or just something that recently started, we may look at other reasons for that also. There may be some trauma that's been experienced. There may be a major change that has happened that's triggered some of this to start developing. But we need to see persistence over time. And then it has to cause significant distress or impairment. Nothing's a disorder unless it's causing impairment for us in our daily life. And then a couple of statistics. So social anxiety, the onset is usually between 8 and 15 years old. So with younger kids, we might see shyness. We might see some of the behaviors that I was describing, but oftentimes the criteria for this diagnosis of social anxiety disorder may really become apparent at ages 8 and up. And so females more likely to be diagnosed with social anxiety than males. And it's about 7% up to, I've also seen statistics of about 12% of the population that have experienced the symptoms to meet this criteria. So it's something that we definitely need to talk about because it is impacting lots and lots of kids and teens. And I wanted to do a whole slide just about avoidance because this is one of the really big factors in social anxiety disorder. I mentioned this earlier, but it's one of the things that contributes to the anxiety and can keep it going because of this cycle that I have here. So we experience anxiety, then we avoid whatever is causing it, and we feel a little bit of relief, just brief relief, not long-term relief. And then what happens is the next time we're faced with that situation, we feel more anxious because we didn't face it last time. So we get stuck in this cycle. And that's how social anxiety and other types of anxiety can start to develop and kind of spiral out of control, or we can get stuck in that cycle. So I like this quote up here that avoidance is just prolonged suffering disguised as safety. We think that we are safe because we got out of that situation, but really we're just prolonging the anxiety and we're actually contributing to it and maybe making it worse. So I have lots of examples here of what are some ways that kids and teens might avoid, just so we know what it looks like. And these are some that I hear all the time and see. Not wanting to go to parties or have parties for themselves, birthday parties. School refusal is a really big one, and that can be really impactful, obviously, for kids. Presentations, one thing that's interesting is they may go up there and give a class presentation, So that's great that they did that, but you may see them over preparing for it, spending way too much time practicing over and over and over again, trying to make it perfect. That still is a form of avoidance because they're not wanting to put themselves out there and just give it a shot. They're wanting to really try to control that situation and make sure that it comes out perfect, and avoid making mistakes. So eye contact is one that, so when I'm doing assessments and I'm looking at eye contact, I'm trying to figure out is the lack of eye contact happening because of anxiety, because of discomfort in the social interaction, or is it just kind of a lack of awareness of the other person, or a lack of interest in making eye contact with the other person? So that I'm trying to see, is it anxiety related? And if it is, it might be a form of avoidance, because avoiding that intimacy of making eye contact, which might make them feel anxious. They may deflect attention to others because they don't want attention on themselves. They may refuse to order food at restaurants. We talked about this earlier, clinging to parents, but also clinging to a familiar person. If you go to a party and you only want to stand next to someone you know, and you don't want them to leave your side, then that is a form of avoidance because you're not willing to kind of go with the flow. You're not willing to talk with others and mingle. It's avoiding that anxiety, that social anxiety. And then speaking very quietly, not being willing to project and really speak up, and not wanting to talk about yourself might be a form of avoidance because that brings attention to you. So these are just, there's so many other examples, but these are just some examples of what we're looking for when we're kind of trying to identify if someone is avoiding social anxiety related situations. And so one question that comes up is, what is causing this? What is causing social anxiety? And there's a couple factors. Not everybody, of course, experiences social anxiety or develops this disorder. And what we know is that there is a genetic component. So if you have a relative with social anxiety, then you have a 2 to 6 times higher chance of developing it. There's also personality traits that might kind of predispose you that we are born with. So if you're born and from a young age, if you are a shy kid, or if you are kind of a more inhibited kid, like you're not willing to put yourself out there as much, you want to stand back and watch. And if you are a kid that's more sensitive to negative feedback, and these are all things that may kind of make us a little bit more prone to developing social anxiety. It still is not a guarantee, but these at the top, these stressful experiences may be what triggers it to become a real problem. Our kids may have the predisposition because of their genetics or because of their personality, but then they may go through a stressful experience that really brings it out in them. And that could be a trauma, it could be a bullying situation, or feeling rejected in a social situation, public humiliation. Like some kids I've had clients that this was triggered after they threw up at school, or they slipped and fell in front of other kids. Something that was kind of a humiliating situation. Change, like moving to a new school, is a big one. So we have kids who were doing fine socially and had friends and things were going well. They moved to a new school, and then we started to really see some of these signs of social anxiety, and that change can really trigger it. Sometimes parents, there has been evidence that the way that we parent our kids, if they already have these personality traits, and then we are pretty harsh and critical of them, and we point out their mistakes, or we kind of act judgmental towards them, then it's also going to potentially trigger some more serious social anxiety. And then this last one, social isolation, that's where COVID comes in. So when we are isolated for a period of time, it doesn't give us the practice and the opportunity to keep putting ourselves out there, to keep interacting with others. And so for kids who already have that shyness and that anxiety in them, then that is something that can really bring about some social anxiety symptoms. And that's what I was seeing again and again with clients throughout the pandemic, and now even after the pandemic. So I don't mean to be overly negative, but I do also want to mention some risks, because I want everyone to understand too that this isn't something that we can kind of brush off and say, oh, they'll get over it. They'll mature and, they'll get past this. It can be pretty risky because of some of the things that it can lead to over time if we don't intervene and do something about this. So girls and boys are a little different in what the risks look like. So for girls, they are more likely to develop depression associated with anxiety, social anxiety, and depression and anxiety we know go hand in hand for many reasons. But I see lots of clients, girls in particular, with a diagnosis of depression and social anxiety. For boys, we may see, this might seem strange, but we may see some oppositional or defiant behaviors, which seems like counterintuitive when it's a kid who is socially anxious. But anxiety can cause us to act out at times, especially in kids and in teens. It can cause some acting out behaviors. And a big one is substance use. And we do see this more in boys, but also in girls. And turning to alcohol or substances to try to reduce that anxiety and to make them feel less inhibited and more comfortable in social situations. And again, it's one of those things that it's kind of a form of avoidance or of coping. It may help in that moment. It may take away some of the anxiety and make it a little more comfortable, but then they didn't face that anxiety. So next time they're going to feel even more anxious going back into that situation. And what are they going to turn to? They're going to turn to what helped them last time. And it becomes, again, another cycle that's hard to get out of. Kids can have higher rates of school dropout because of the impact on school, socially, academically. And then we also see in the long term, we see this affecting employment in adults. So one of the risks is that there's lower rates of successful employment or productivity in the workplace, because in most workplaces, we have to be social and we have to interact. And I've had lots of clients I've worked with on that issue of, how to be able to function well at work when you're feeling all this social anxiety around your peers. And so all this impacts their quality of life. And in relationships, there's a higher likelihood in adulthood of staying single and not getting married or even getting a divorce, because it absolutely can impact relationships and being able to put yourself out there to meet others. So there are some risks, and this is something that we need to take seriously. I want to say this is unfortunate, but about half of all individuals with social anxiety will never seek treatment for it. Based on the statistics. And so that's really unfortunate because we know that it can impact your life in these ways. So treatment is important. I think it's great and it really critical if we can identify this when our kids and teens are younger, and we can start working on it now so we can prevent this from becoming a bigger issue and give them the tools they need. And so how do we treat social anxiety? So this is the big treatment. It's kind of the one that is most evidence-based, research-based. Most therapists are trained in this. CBT stands for cognitive behavioral therapy. Many of you are going to be familiar with it, but it's based on this little triangle here, which is your thoughts, your emotions, and your behaviors, because we know that they all impact each other. So cognitive behavioral therapy is the idea that we're going to target our cognitions, our thoughts, and we're going to target our behaviors in order to change our emotions, because we know that we can't just shut off the anxiety. If we're feeling anxious in a social situation, we can't just stop feeling anxious, but we can change the way we're thinking, and we can change some of our behaviors, which then actually can reduce our anxiety. So it seems pretty logical, but I can tell you as a therapist for many, many years, this absolutely works. And in graduate school, I was part of a program that had a really excellent research department focused on social anxiety, and they were developing a CBT protocol, and it was just so effective. All the research has shown how effective it is. I've seen this work in my clients again and again and again. And so the good news is that social anxiety is one of the most treatable mental health conditions. It's very treatable. You absolutely can get better. You can feel better. You can feel less anxious. And so that's really great news. And I always want to share that also with our kids and our teens that are struggling with this, that this is something that can change. You can feel better, but you have to learn how, and you have to put in the effort and the work. So here's the thoughts part of this. So when we have social anxiety, when we're experiencing social anxiety, all these negative thoughts are going through our head, and they tend to not always be accurate or logical. But what's strange about that is that they're just automatic, and we just tend to accept them as if they're the truth. And so what we do in therapy is we help people step back and look at their thoughts. And kids and teens can do this. They're very good at doing this. You can look at your thoughts and you can say, is this an accurate thought? Is this a helpful thought? Are there any what we call thinking errors going on here? And there's another word for it in that yellow box is cognitive distortions. These are just categories of thinking errors that we see people making when they have these negative thoughts. So I won't go through all of them, but a couple of them to point out, like catastrophizing. We all kind of know what that is, like blowing things out of proportion, making things a bigger deal than they really are. Like, this party is going to be a disaster. I don't know why I'm going. It's going to be horrible. And then I'm going to make a fool out of myself, and then everyone's going to hate me. I mean, that's catastrophizing. We should is in there. One of those bubbles says should, because we use a lot of should statements. Like, I should have done this. I should have said that. Why didn't I say this? Discounting the positives, that would be a situation where, let's say I went to the party. I showed up at the party. I stayed at the party, but I went home and I beat myself up over everything I said or everything I did at that party. But I'm not giving myself any credit for the fact that I went and I stayed. And that's awesome that I was able to do that. So it's discounting those positives. There's lots of these thinking errors that we make. And what we teach our kids and our teens to do is challenge those thoughts. Don't just accept them, but fight back. Say something back to those thoughts that might be more accurate or more helpful or more rational. I like this. I saw this picture and really liked it because she's carrying on her back these boulders that represent the past, the present, and the future. And then it says, when it all gets too heavy, it's okay to put it down. So she put down the past, she put down the future, and she's only carrying the present. And that's exactly what we need to do and help our kids do who are experiencing social anxiety. Because on the left here, you see that a lot of their thoughts are related to the past or the future. So the past, they tend to what we call ruminate, which is just going over and over what they said, what they did in the past, and getting stuck on that and being very negative about it. Why did I say that? I shouldn't have laughed. I probably offended her. I wish I never went to that party in the first place. And then the future thoughts are things that haven't even happened yet, but we're feeling anxious about it. And we're thinking, what if I say the wrong thing? I'm going to embarrass myself. They'll think I'm weird. So none of these things are happening right now. And our mind gets so caught up in the past and the future that it takes us out of the present moment. This happens with all of the kids that I see with social anxiety. And if we can get them to put those past and future thoughts down and really focus on the present, it goes a long way towards reducing their anxiety. So one way to do that is this strategy of mindfulness, which is such an important skill that we can teach our kids and our teens. But it's the idea that we're trying to get them out of their head and into this present moment. So they're not thinking about the past and about the future. They're just living in the moment. And a couple ways to do that is teaching them to, be curious. If they're in a social situation, be curious about the other person. What do you want to learn about this person? What questions do you have for this person? And be an active listener. So if the other person is talking, don't be thinking in the back of your mind, what am I going to say next? Or, oh, I probably look so weird right now. Or what does my face look like? Instead, we need to teach them to really listen to what is the other person saying to you. So they're keeping an outward focus, not an inward focus. And one of those mindfulness strategies is teaching them to just treat their thoughts as just background noise. It's just there in the background, but I'm not paying any attention. I'm not giving any attention to those thoughts. They will be there. Those automatic thoughts, they keep coming at least for a while until we really kind of ignore them long enough that they come less and less. But even if they're there, it's okay. They can just be background noise. We don't have to pay attention. This is a skill that takes a lot of practice. It's not easy, especially when our brains have gotten in the habit of just overthinking all the time. And so it's something that we can practice with our kids. It's something they can practice and learn in therapy as well. But the good news is that mindfulness is something that's very, very effective with kids who have social anxiety because it improves self-esteem. It increases their ability to pay attention and focus, and it decreases their anxiety. So it's something that we need to include when we're trying to treat this disorder and when we're trying to give them tools. And the behavior part. So I showed you that triangle earlier with the thoughts and the behaviors and the emotions. And we talked about the thoughts, and this is the behavior part, is facing their fears. And the first part of that is figuring out what are they avoiding in the first place so that we can help them to not avoid. Because like that cycle that I showed you, anytime they avoid, it only gives them immediate relief, but not long-term relief. It's going to keep the cycle going. So we have to get them to stop avoiding. I wouldn't recommend just throwing them in the situation, and especially if it's something that's too much for them. That can actually backfire. That can be one of those humiliating experiences that can actually contribute to the social anxiety. So instead, I would recommend kind of taking steps, just some baby steps in the right direction. In therapy, we actually will come up with a hierarchy where we will start with, at the bottom is the easiest, least anxiety provoking experiences, and it goes all the way up to the top, the hardest one, and we kind of work our way up the hierarchy, which works really well because anytime you face one of those fears on that list, it actually starts to impact all the others. All of the others seem less scary when you've tackled one of those. So take baby steps. Another big thing as a parent is that we have to project confidence. So if we're kind of projecting anxiety, if we're feeling nervous for them and we're saying, are you sure you're going to be okay? You don't have to go if you don't want. It's okay if you want to stay home. Then we're not projecting confidence there. We're actually sending them the message that maybe they can't do this. So we have to, even if we don't feel it, we have to project that idea that you're going to be fine. I know you can do this. Let's do this. I'm gonna be there when you go in. I'll be there when you come out. I'm confident that you can do this. I'll just give you an example. On the right there, I have a bunch of small little examples of how kids can, or adults can, face their fears. One of the things I've done with my kids, anytime I see an inkling of that social anxiety rear its head, I nip it in the bud because I do not want that to start developing. And we do have that in our family. And it's something that I know may be a problem for my kids. So my daughter struggled with ordering food at restaurants. It terrified her. And so I walked her step by step. I would say, I would ask her what would she like to order in front of the waiter. And then when she got better at doing that, then I would talk to her beforehand and say, okay, today I want you to order, and I know you can do it. And she would practice with me and tell me what she was going to order. And now today it's like not a problem. She does it all the time. We've done that with phone calls too. When they're terrified of making a phone call, then that's something we're going to work on. We're going to start practicing that. One of the things I want to say on here is do not come to their rescue. It's so tempting as parents, and I'm tempted also. We hate seeing them uncomfortable, feeling anxious and terrified, and we want to take that away from them and make it better. But that's not going to help them, especially when we're dealing with social anxiety. If you rescue them and you pull them out of that situation, then you're actually enabling that fear, you're contributing to the anxiety, and you're going to continue that cycle. And we don't want to be part of creating that problem. And so don't come to the rescue, as tempting as it is. They need to feel the fear and do it anyway. That's a really big, important lesson for us as parents, and we need to teach them that too, because we all kind of assume that if it feels uncomfortable and it feels scary, we shouldn't do it. And one thing I can tell you as a psychologist is that that absolutely is not true when it comes to anxiety and dealing with anxiety. I would actually say the opposite, that it's good to do something that makes you afraid, a little bit afraid every day. You know, it's like eating an apple a day keeps the doctor away. I think doing something that makes you a little bit afraid every day keeps you feeling confident. It keeps the social anxiety away and the other forms of anxiety away as well. So facing fears is a big one. I liked this quote because this kind of summarizes it. Inaction breeds doubt and fear. So if we avoid, we stand back, then it's just going to create more doubt and fear. Action breeds confidence and courage. If you want to conquer fear, do not sit at home and think about it. Go out and get busy. And I 100% agree with this as a psychologist. This is what I see in every client I've worked with anxiety, and especially with social anxiety. The more that we can get our kids to go out and do the things that scare them, and the more action we can get, then the more progress we see and the lower the anxiety over time. And, you know, it's something that they can be night and day difference as adults. They can start out as very shy kids. They can struggle with social anxiety. And if they can use these strategies we talked about and these tools, they can grow into adults that are confident, able to go into any situation, and that fear just won't be there. I do have to say that anxiety is something that's an ongoing, um, it's something that we may deal with throughout our lives if we are people who have that genetic predisposition or that temperament, that personality. But if we can learn these tools when we're young, then we can never let it become a big issue for us. And that's why I've kind of taken those actions with my own kids. I've watched for those signs and just always nip it in the bud right when I see it, because there's just no reason to let that form into one of these cycles. Um, so just to summarize some parenting tips that I think are important, and I had I did another presentation some of you guys may have been there for, just about in general parenting anxious kids, and some of these are some of the same parenting tips, because any type of anxiety in our kids, we are going to need to follow some of the same strategies. So in this case though, we really need to set a good example of socializing. So make sure that you as a parent are also putting yourself in social situations and bringing your kids along with you. So maybe if you're a parent who struggles with anxiety yourself or shyness, you know, that may be outside of your own comfort zone. It might not be something you want to do, but it's something our kids need. And so we kind of have to push ourselves as parents to make sure that we are setting a good example. We're being social. We're starting conversations. We are going up to the counter and asking someone a question if we have a question. We're putting ourselves in those situations because we want them to see that. Don't lower your expectations for them. If you have one child who's shy and the others are more confident, don't allow the shy child to stand back and get out of things. There's no reason for that. They are absolutely capable of doing the same things. It just, we may have to go about it a little differently. Like I said earlier, allow them to feel the anxiety. They have to feel it. That's an important thing for all of us to know. They have to feel it in order to get through it. Avoiding it will not work. We need to teach them some coping skills, like that mindfulness strategy that I talked about, but also other coping skills, working on our breathing, some breathing techniques, finding things that help us to cope in those moments when our anxiety is high. And we can teach them that as parents in practice. Help them always face their fears. If you're spotting those fears, help them come up with a plan for facing the fears. A really helpful approach when you have anxious kids and socially anxious kids is to be firm, but be supportive. So we don't have to be mean, but we also don't have to be so lenient that we let them out of things. So we can say, hey, I know this is hard for you. I know you're feeling nervous, but I know you can do this. And I think you're going to do great. So let's go on in there and let's do it. We can stick with our plan and not let them out of it, but we can be nice about it. And really praise them for any of those efforts that they make. One of my kids, when he was younger, he was really, really painfully shy. And, people would try to say hi to him. He wouldn't say hi back. And so I would work with him on one step at a time, maybe just he wouldn't even wave. So I got him to start to raise his hand just a little bit. I would tell him, awesome, that was so good. I'm so proud of you. And we just took it step by step, but we have to praise those little successes so we can get them to move in the right direction. And then reach out for help, of course. So I talked a lot about therapy. And so if therapy is an option, and like I said, only about half of people with social anxiety ever receive treatment, and it's so treatable. So these are strategies you guys can use at home as parents with your kids, but you absolutely can reach out to a therapist to do some more structured CBT therapy with your child if they're really struggling with social anxiety, because it really does work. And I told you I had a list of some therapists that I recommend on my website, but another great resource is psychologytoday.com, that website. You can go in there, you can do a search based on your insurance, based on the age of your child, whether you want a male or female therapist, your location, and you can kind of narrow it down and look for a therapist that way. And these are a couple of books that I wanted to recommend that are some great books about social anxiety and about anxiety in general, and all of them written by psychologists. They're all based on a lot of the strategies that I talked about today, but a lot of them kind of go through more detail and even step-by-step process of how to work through social anxiety or any type of anxiety. And then just, again, feel free to reach out to me if you have questions, if you need resources. Here's my email address, and I have a contact form on my website that you can contact me through as well. So I think that's all that I had, and hopefully there's a little time left for questions.
Yes, for sure. We definitely invite you to put your questions in the chat box. And Lindsay, if you will put in the chat box the psychologytoday.com, I think that's what you said. And that way they can have that link as well. So I think, you've brought up such great points on kind of the things that you were talking about, and a lot of these things, I think helping them along, and just the little things that as parents that we may say that may be discouraging when we're not trying to be, or like you said, I'm guilty. I'm definitely guilty in the past of, oh, you don't want to go, okay. Like, oh, you think it's going to be bad, well, you don't have to go. So I do think it is true. And it's like, you think about the things that you've had anxious thoughts about over your life, like, a person starting a new job, a new school, a new anything.
Yeah.
You're meeting a person for the first time, and it's always much scarier in your head
Yeah.
of how it's going to be. And then you're like, man, I can't believe I couldn't even sleep last night about that, and then
Yeah.
it turns out great. So that
And
is
it's fine.
definitely true.
That's
Um,
that anticipatory anxiety. Yeah. Like we think about it beforehand and we stress about it beforehand. And then the situation often isn't even that bad.
And I think a lot of our kids, I think a lot of our kids are painfully aware that they might be a little bit different, and maybe they have some learning challenges. Maybe they're twice exceptional. There's a lot of, different, along the way that they may be. And the truth is that the school, it doesn't matter what school. I mean, there are mean kids, that there just
Right.
is. There are bullies. That is a fact. And so some of that is, manifested as a result of some of the stuff that they've learned, or they feel bad already about themselves because they're behind, because they're not as quick on their toes and answering questions, or getting the right answer, or things like that. And it just kind of balloons from there. So we do have a question: is anxiety genetic?
Yes, it absolutely is genetic, and not 100%, but it's partially genetic. So we can inherit kind of a predisposition to developing anxiety. There's certain areas of our brain that might that might kind of predispose us to developing an anxiety disorder. And that absolutely can run in families. And depression and anxiety are both very much linked through the neurotransmitters that they involve. And so sometimes either one of those can be inherited. So if you have a parent who suffered from depression, you also might be more likely to develop an anxiety disorder because those two things are so interrelated. But yes, there's absolutely that genetic component. And then on top of that, there's the environment, right? So as parents, let's say I'm a parent who is socially anxious, and so my child may have inherited that genetic component, but on top of that, I'm probably modeling some of that for them, right? I'm probably staying out of social situations. I'm probably going to be more anxious around other people. So they're coming to it from both sides, from the genetic side as well as learning. And we can help with that by working on our own stuff, right? And by, trying to tackle our own anxiety and our own confidence in social situations so that we can model those good behaviors for our kids and help them to not develop this as a diagnosis.
And we've talked about this before, that the apple doesn't always fall too far from the tree.
Yeah.
That when you have a child with ADHD, ADD, you may have a parent that has some of those tendencies, and depending on your age, it might have not been the generational thing to go get diagnosed with ADHD. But as parents, we do see a lot of parents that also have some of the same diagnoses, but maybe not treated.
Yeah.
What do you think about that, Lindsay?
For ADHD in particular?
Yes.
Yes, so absolutely. ADHD, because of what we know about the brain and ADHD, it's really a way that your brain is wired. And so we know that that is inherited. It's hugely genetic. And so, yeah, absolutely. It's something that we probably have parents or grandparents or other family members that have the same brain wiring. But one thing I should mention, I have a whole other presentation on this, but when you have an ADHD brain, you also are more likely to develop anxiety and depression. And it's because of some of the differences in the way that your brain regulates emotions. And so that's another factor that we have to keep in mind with our kids who have ADHD brains, that they may already, not just because they have a genetic predisposition coming from family members who may be anxious or have depression, but because they have ADHD brains, that already puts them at risk.
Those comorbid conditions. And I know when we, have these meetings, we have people all across the board that have young, maybe a new diagnosis. We've got teenagers, maybe some older, and things like that. But things change. I know, Lindsay and I were talking about this, that they change, and they change drastically and sometimes rapidly in those teenage years. And sometimes as parents, you don't feel like you're going to survive this. Like, it's tough. But those comorbid conditions are a real thing. And sometimes they start rearing their head in those early teen, mid-teen, and late teen years. And sometimes we've even seen people, early 20s as well. And some of them can be pretty significant. So it's really, really important to keep an eye on all of those things. And so let's talk just for a moment about testing. I'm a fan. I am a huge fan of testing, because I feel like if you know what it is, you know what it's not, right? And it's not about the label, because I think some people get hung up in the label. Some people don't get the testing because they don't want the label, that diagnosis, and other people do get the testing because they want to know. So that way, how can we help? Like, how can we give the child the tools and resources that they need to successfully navigate whatever it is? So what is entailed with testing? What should somebody expect? And why are you a fan or not so much of testing?
Yes, so I agree. I am a fan, of course, and the way that I see testing or these evaluations, psychological evaluations or educational evaluations, the purpose of them, like you said, is not to diagnose or put a label on a kid. The purpose of it is to understand the child better, to understand the way that their brain works, to understand how they learn best, what are their needs, what do they need in order to succeed. And that's what those of us who do this type of testing, that is our ultimate goal, is to figure out those things and help you as a parent understand your child better, but also help your child understand themselves better, and how their brain works and what they're good at, what they need help with. I think all of those things are really the ultimate goal. And then also to get to the next part, which is, what are some recommendations? What are some ideas and strategies like we talked about today? If we know that a child is struggling with social anxiety, we have treatments and we have strategies for that. So we can share that with you.
And I think also a big part of it too is some of those strategies that might need to be implemented in an IEP or a 504 at school when you're having ARD meetings to get those accommodations in place, to give your student as many tools as possible
Yeah.
for success in the learning environment. Because
Yeah.
the more failures that they have, we all fail, we all make mistakes, and we all move forward from them. But the more failures that they have in that school environment, the more
Yeah.
it just starts dominoing. It starts
Yeah.
getting worse and
It
worse.
chips
And
away.
I feel like
Yeah.
early intervention as soon as possible, and I don't believe in like beating yourself up. Like if you say, "Oh my gosh, I didn't know this," then it's not about beating yourself up about what you haven't done, but the sooner you can get those interventions and that those like, those accommodations in place if your student needs them, I think it's important. So I use it as a tool, not for the label per se, but we want all of our kids, whatever their disability may be, to have live their best life and to be the best that they can be and thrive. And so I think that it started with the testing and understanding what we were dealing with. Because maybe
Yeah.
it is just ADHD. Maybe they're also on the spectrum. Maybe it's a variety of, I call it alphabet soup in the mental
Yeah.
health arena. We like acronyms and initials in this arena, but I think it's
I
valuable.
agree
So
though. Yeah, and oftentimes I have clients come in wanting to answer one particular question with the testing, is it this? But what's interesting is that we find out so much more, like we can learn not just is it this, but we may learn that there's multiple things, multiple factors that are at play. And we may learn that it's not what they were thinking at all, it's something else. Or,
sure.
we may learn more about their child's strengths and things, areas that they need to really encourage because these things showed up during the testing. I think it's just fascinating because it's a way for us to understand them better.
So we got a couple of questions. Do you need a referral from the child's pediatrician to get tested or to get therapy?
No, you don't. Really, for most providers, you're not going to need a referral. We do get referrals from pediatricians, but that's not required at all. Families can self-refer. So for me personally, for my practice and the testing that we do, families can just contact us through my website, fill out the contact form, and we can get things started that way or share information with you that way. For most therapists, you can just give them a call, or even email them and get the process going that way. So it's very easy. You don't have to go through a referral process.
That's good.
Yeah.
Okay, so one person said, do you have another session or schedule of this webinar? And Lindsay, I know you mentioned on your website you have some links to some other webinars, and on the Consolidated Planning Group YouTube channel, we have hundreds of webinars, and we've
Awesome.
partnered with Lindsay in the past as well. And this has been recorded, so everybody that's attended tonight is going to get a copy of the slides and a link to the recording. So anybody that wants to share this with somebody else, you absolutely can. You're going to get that. It'll probably be tomorrow, but you are going to get the slides and the recording. This is a great question. I love it. What are some accommodations that would be recommended for children with social anxiety?
That is a great question. So that social anxiety is a tricky one because sometimes with anxiety, one of the accommodations or some of the accommodations we may recommend would be to, not call on the child in class, or to let them leave the class and go to the counselor's office as needed. Those kinds of things to help reduce the anxiety so they can stay in the school environment. With social anxiety, it's tricky because we also want them, like we talked about today, we want them to be facing those fears. But I have to say that we can't just expect it to happen magically. They're not going to just be prepared today to face those fears. So the way I use accommodations with kids with social anxiety is I use it as just a temporary option to help keep them in the classroom, in the school, make it a supportive, less scary environment. And then I work them up that hierarchy so that we can take those away. Because we don't, for those kids, we don't want to continue to provide those accommodations if it's actually enabling the anxiety. So, temporarily for the short term, while they're getting started with treatment or while they're working on starting to face some of these fears, then it's okay to ask for some 504, Section 504 accommodations, like I said, being able to meet with the counselor as needed and leave class if they're experiencing high anxiety, to ask the teachers not to single them out or call on them in class, to have extra opportunities to check in with the teachers privately so that they don't have to raise their hand. Things that are going to just make it a less scary environment, but it has to be clear to everybody that this is temporary, but we're going to work on this so that you no longer need these accommodations when we get to the point that you're feeling more confident. But the only reason I would use those accommodations, honestly, is in more extreme cases. So I've had clients who school refusal is a big problem for them. They do not want to go to school. They're crying, they're having tantrums, they won't get out of the car. Those are cases where we need those accommodations just to get them into the school, keep them in the school building, for the full day, because that's progress if we can do that. And then we need to slowly kind of take away the accommodations. I would say for most of the kids I've worked with who have social anxiety, if that's their only diagnosis, then they don't necessarily need accommodations unless you're seeing some severe impact at school. And a big one is just getting the school counselor involved. Because they
And
can help
I
them.
want to mention too, Lindsay, because we are commonly looking at comorbid conditions and we're talking about the social anxiety. I know for one of my kids, some of those accommodations, like for ADHD, was, if they had working memory issues, extra time to complete assignments or taking tests in uh, a non-distracted area, or some of those things. There's so many different accommodations out there. We've done a lot of webinars with educational advocates and how to get the ARD right and how to get your IEPs and your 504 set up properly. And I feel like the answer is it really really depends on the kid,
100%. Yes. It
because
depends on
there's
what are
so
they
many other
struggling with.
factors.
Yeah, what are they struggling with at school? What are the goals for them? And based on that, we can kind of decide what accommodations to ask for. Our kids with ADHD brains, they need the accommodations. I'm a huge fan of accommodations because the schools are not designed for the way their brain works. So we need to make it a better fit for them by getting some of these accommodations in place. So because of their ADHD, they're going to need some of those accommodations in place. If they also have a separate diagnosis of social anxiety, then we need to figure out, how severe is it? How much is it impacting them in school? Are there some short-term supports that would be helpful to include in that 504 plan? But for their ADHD diagnosis, they absolutely need that 504 plan and they need those accommodations. Yes.
And so, but the bottom line is there are professionals out there that can help you. You don't have to know all of this stuff, like the back of your hand. And there's definitely professionals out there that can definitely help you with all of this. So what I would say, again, everybody's going to get a copy of the slides and a link to the recording. It's going to have Lindsay's contact information. So if you need testing, certainly reach out. And what I also love about Lindsay, sorry, this is the Love Lindsay night. Lindsay has she has curated a lot of wonderful list of other professionals that might be able to help you in your journey. So, and so if it's something that she can't help you with per se, then she's got a list of people that she knows can, that are pretty awesome. So I do love that about you, Lindsay, as well. So, just as a reminder, the email that you guys are going to get, it'll have a link to how you can join ADA. Should you want to join ADA, we do encourage you to do that. And I want to mention again that there are groups all over. We're in Fort Bend County. We mostly are talking to parents and have helpful parenting tips and all kinds of stuff as it relates to kids with ADHD. But there's a lot of other groups out there that might be able to help you on your journey going forward. So, Lindsay, as always, thank you again for joining us tonight, and such wonderful information and tools for us. I appreciate it, and we will look forward to partnering with you again soon. Thanks everyone for being here, and thank you for your questions. I hope everybody has a great night. Take care.